We travel to different places, don't we? Similarly, when we are unwell, we are sick, we visit the doctors. We visit different categories of doctors, specialists for that specific problem. Today, we are going to talk about doctor specialties. Doctor is a common term. A family doctor is generally a GP, a general practitioner. However, for specific problems, we visit those specific doctors, right? A skin specialist, maybe a heart specialist. So today, I am going to help you with the right pronunciation of those specialties. I am going to tell you how it is pronounced, what do those doctors mean, what do they specialize in. Let's begin then. So with the doctors list, let's talk about the first specialist for today. The first specialty for today is dermatologist. He specializes in skin problems or skin allergies, skin ailments. He's called as dermatologist. The stress is on top. The second one is a heart specialist. He specializes in your heart, cardiovascular diseases, right? So he is none other than the cardiologist, not cardiologist. I've heard people saying dermatologist, cardiologist, but dermatologist, cardiologist. The stress is on all. The next category I am going to talk about is a female disease specialist or also a female reproductive organ specialist. None other than the gynecologist. The stress is on CAW, gynecologist and not gynecologist. I am visiting the gynecologist today. So every time you're visiting a gynecologist, make sure that you say gynecologist and not gynecologist. It's not gynecologist, gynecologist, gynecologist. I have visited this doctor n number of times. Very unfortunate, I didn't take good care of my teeth. So I had to visit the dentist many times in my childhood. I did not brush my teeth twice a day. And I would always advise people to do that so that your teeth are stronger and cleaner and without cavities. So dentist is what I'm talking about here. Dentist. The stress is on den, the first part. Anything to do with our eyes, we would visit the eye doctor. Now, what is the eye doctor called? Ophthalmologist. Ophthalmologist. The stress is on more. Ophthalmologist. Optometrist is different. He or she would help you with your glasses, do a regular eye checkup. That does not mean the optometrist is also the eye surgeon. No. He will guide you to the ophthalmologist, the eye surgeon, the eye specialist. Most of the times, if you haven't been taking care of your bones and muscles and they start giving you trouble, that is the time you visit the orthopedist, right? The orthopedic surgeon or orthopedist, which means bones and muscle specialist is the orthopedist. The stress is on P, orthopedist. Anytime any of your family members or even you have been taken to the operation theater, the first person who will come and register you with an injection, anesthesia, is the anesthesiologist. He is a specialist who will give you the anesthesia, so he is the anesthesiologist. None other than anesthesiologist. Stress is on all. Anesthesiologist. Anything to do with your hormones, okay? You will be visiting the endocrinologist. The endocrinologist will help you with your hormone-related problems and disorders. Endocrinologist. Stress is on? No. If you want to get rid of your problems related to your digestive system, you have to visit an expert. He is none other than gastroenterologist. Yes, my dear friends, it's a little complicated, difficult, long word, but the right way to pronounce this doctor specialty is gastroenterologist. Enterologist. Stress is on raw. If you have problems related to your blood and the bone marrow, you must be visiting the hematologist. Heme, blood, right? So hematologist. Hematologist. If you have any diseases related to your liver, you should be visiting the hepatologist. Hepatitis, remember? Jaundice. So hepatologist. Hepatologist. We have been seeing many problems these days related to the newborns. Just newborn babies, they are in the ICU or in the incubators, right? So all these are handled by, cured by the neonatologist, who specializes in critical illnesses related to the newborn. So neonatologist. I know, new word, so many words and so many long words, different pronunciations. You will come to know gradually what is the right pronunciation, but I really want you to make a conscious effort of pronouncing them correctly. Anything to do with your brain, spinal cord, nerves, nervous system, you must be visiting the neurologist, right? Neurologist. Stress is on raw. Who doesn't know a child specialist? We all know the child specialist is a pediatrician. Whenever you hear the word pediatrician, you know that he or she is the child specialist, which means he or she specializes in problems, health hazards related to the children. Cancer surgeon, cancer specialist is none other than the oncologist. Whenever you heard the word onco, it is cancer, cancer-related specialist. So oncologist. Many times we see that there is a hearing loss in children, ear-related issues. We should be showing them to the audiologist so that we can cure the hearing loss problem in the children. We all know who is the ENT specialist, don't we? Ear, nose, throat. ENT specialist. So anything related to your ears, nose and throat, you should be visiting the ENT specialist. Psychiatrist. When do we visit the psychiatrist? Whenever we feel that there is a disease which is related to a mental illness, it's not just a physical illness, but it's a mental illness or mental disturbance, some kind of problem related to your mind, we should be visiting the psychiatrist. Stress is on chi. The next one is pathologist. Now, pathologist is not a doctor actually if you go to see, but I have heard this word also commonly being mispronounced as pathologist. I visited the pathologist. These are the people who do your tests, your blood tests, sampling, urine, stool, all of that in the pathological lab, laboratory. So pathologist, a person who specializes in all these tests and identification of the problem. I would like to take one more, which is epidemiologist. Very much related to the current situation, because this situation, though it's not an epidemic, however, it's a pandemic because it's coronavirus, it's COVID-19 situation that we are in. But let me tell you an interesting thing here about the epidemiologist. The epidemiologists are the people who actually try to find out the potential diseases around and try to develop a vaccine for it. So these are also very important people for us, the epidemiologists. So I have done quite a few specialties and the right pronunciations, also what they specialize in, what they deal in. I'm sure you've got a lot of information. Try to understand and practice. I hope you liked watching this video. Give me a thumbs up if you did. Please ask your questions in the comment section. Don't forget to subscribe to my channel and hit the bell icon for more updates.